Welcome to the wonderful world of wellness with Dr. Andy Mencia. This medical program heard from 7 to 7:30 each Saturday right here on WSBR 740 AM is brought to you by the Adult and Geriatric Center under the medical direction of geriatrician Dr. Andy Mencia.
Well, good morning.
Good morning. Good morning. We're talking about breasts this morning.
Breast. Yeah, I'm so happy. Let's talk about breast.
Well, it's great that they have now attributed breast cancer for, like a whole awareness. They have the whole month to be aware.
Right.
To be aware every day for the whole year.
For the whole year, right. Yeah, it's a lot of things like that. At least, we take 1 month as a society. That's what this is all about.
And, I like, Dr. Mencia, that men now have become very involved in the marches and for the women. This is
right. It's for both, Men get breast cancer also. So it's both. What happened, women, they have much more breast tissue. And the hormone that they have to produce milk, can be much more active in a woman because they have more tissue. So therefore, they are more prone to breast cancer. A lot more prone than a man will be. But men can also be used this month for themselves to get checked. I already checked my breast this month to make sure.
So you
feel your breast tissue and look for any lumps. And of course, a man will easily feel the. I like that. No, I tickle myself.
But you
Richard, don't get any idea there. Richard is feeding him. No, just the breast, Richard, not your belly. So, for a man, it's very easy. We don't have that much tissue,
right?
So it's easy, and we feel the ribs very easily. Right. So, a woman, the more breast they have, the more difficult it becomes. So that's why we say for a woman, it's important that they lie down, especially if they have big breasts. And
so it flattens it down.
It flattens them down.
Right.
But then you have to remember when you lie down, if it flattens and they open to the side, you have to make sure that all of those tissues, it's like looking for a nickel in a bag without opening the bag. And you have to find where the nickel is. So you have to go through the entire breast when you are feeling the breast, looking for any abnormality.
Well, you gave a very interesting story about a patient.
It just happened yesterday.
Such a coincidence.
It just happened yesterday. Nadira was there, one of my medical assistants. And Nadira said, oh, my God, I was so worried, so concerned. I thought this patient had been coming to us for so long. Now she found herself to have breast cancer. So Nadira was already going through the chart, looking for her last mammogram and what have you. And I walk into the room. And I see both of them giving me that look. I say, what's going on? She's so worried. She has a lump in her breast, and she thinks she has breast cancer, so she's concerned. I said, okay, let's take a look. So I'm there with one of my students. I walk in the room with one of my students. And she lifts up her bra a little bit because it's underneath the right breast. She just lifts up her bra a little bit, and she had a pimple. So I told Nadira, okay, we can fix this. Just give me a needle and a spoon. I didn't put this one on Facebook because, it's a breast. But we took a needle and we pricked the little cyst that she has, and we drain it and put antibiotic. And then I say, okay, just go home and put it back.
Wow, what a
and
relief.
she said she couldn't sleep the night before because it was so painful. And, those cysts, like people that get cysts on their face, they can be very painful. So she was so concerned, she couldn't sleep, nobody could sleep at home. So one thing that, like we said before we went on the air, at least she did the right thing. She came immediately to see me. Some people, they just sit and wait. They go on the internet, they start doing research.
They're afraid.
And they just say, no, it's something that you need to trust your doctor to go immediately and say, check me out now. It's not refer me to a gynecologist, a doctor or a nurse practitioner or a PA. We are supposed to be the front line. I don't like the word gatekeeper, because gatekeeper
Yeah, I
is
don't like
like
it
keeping
either.
you
I
away
hate
from
it,
getting
yeah.
treatment.
But
The front line we should be to be able to handle all of those things.
But Dr. Mencia, you've had patients who've had breast cancer, I'm sure. But so my
men and
question
women,
is,
I have men and women with breast cancer.
so my
yeah.
question is, would it just come about that quickly? I mean, you feel it, and it's. I mean, I don't really understand how that all works.
Breast cancer, what happened, tissue like lung cancer in a smoker. When you smoke, you are taking normal tissue that tend to regenerate itself. So imagine your skin. The skin, it turns over every 30, 36 days. The skin that is all the way at the bottom, the baby cells that were born today, in 30 to 36 days from now, they're going to be dead skin on the top. And the cycle will continue like this. Now, if I go to the sun and I give myself radiation through the sun, I can take some of those cells, especially the baby ones that are so vulnerable, so fragile, and take some of those cells and disrupt the part that control the genetic, which is the nucleus, has all the genes in there. So a gene that is supposed to be doing a protein for the cell to be strong suddenly get hit by this radiation and start producing fat instead of protein. The problem is when you alter the genes, one of the things that the way our body was made is that cells, they tend to respect each other, different from us humans. Cells tend to respect each other. So when a cell comes and stand next to you, you stop growing so that cell can grow too. Cancer cells have no respect for the cell next to it. So they just keep growing. It becomes, we have one patient, that we saw the other day, the one that had a big lump on her lips. She had a huge lump on her lips. And the only person that I know that is a good oral surgeon that would take care of that was in Cleveland Clinic. So I sent her to Cleveland Clinic. I said, I want you to go there, and I want you to see this person for the surgery, and then come back to me. I do the clearance. And she had a squamous cell. It was a cancer. It was growing at such a speed that the only thing, they want to take a biopsy. I say, forget about biopsy. Go straight to this person and tell them the biopsy is remove the whole mass. Oh, but my lips. I said, your lips, we're going to save your life. And of course, right then and there, when they took her to the operating room to make sure they were not making a mistake, that I wasn't cuckoo, they went and took a biopsy inside the OR, and they proved, no, this is cancer. So they cleared the whole cancer out. And, we only save the face because, the deeper it goes into the lips, right? The more you're going to have to alter the lower lip on that person. So we were able not only to, we save her life and we save her image as a woman.
But had
as
she
a young
waited?
woman.
Did she have that for a while, or it just happened?
Oh, no, it happened and it was fast. It was aggressive. That's what we call, a passive cancer is, when we get those little cancer on the skin and we let it be, and then we go to the doctor and they say, it's cancer, so we're going to remove it. But then you have aggressive cancer, like let's say melanoma of the skin. So breast cancer is the same way. I don't want to divert from that. Breast cancer is the same way. It can be very aggressive. As a matter of fact, sometimes when we're talking to the student about breast cancer, we say, sometimes when we look at the breast, just inspecting the breast, and we look at the breast and we see and women and men, they should do that. They should look at their breast in front of the mirror, not only palpate it, but look at them. So if you see a quote-unquote little rash on one side of your breast, not on the nipple, but on the skin, and it looks like what we call the orange skin appearance. So it looks like, the skin, it doesn't look smooth, but it looks like dry skin like that, and it's a little bit red. That's indicative of a cancer underneath the skin that is trying to, grow at a fast speed. So you need to attend to that. So whenever you see even a rash, Now, women, especially diabetic women, and they have big breasts, underneath their breast, they can get a rash. It's red and moist and itchy, and usually it's a fungal infection. But when the rash is not there, it's on your breast and on the skin, and you see that, you should immediately go and get a check with the doctor. And if your doctor is downplaying, go to your gynecologist and get a check. But
But what about the mammogram? We started
and
talking.
before we leave that, some doctor, I have seen a few cancer like that present with a. I'm sorry to interrupt you, but
do this.
I don't want to leave that topic. It's so
Right.
important. I have seen patients, unfortunately, that have come to me like that, with a rash, and they go to a doctor, and the doctor say, "Oh, put steroid on it, see if it gets better." That's the worst thing you can do. You do not want to put steroid on this thing. If and I'm, I always tell my audience, man, you are a consumer. This is, when you come to me with an insurance or a credit card, you are paying for your care. This is not free. Somebody's going to pay. You pay the insurance every month, or you work all your life and you got Medicare. When you come to me, I'm not seeing you for free. I'm getting paid to see you. So it's not a freebie. I'm not doing you a favor. I'm doing my duty. This is what I study. So when you go to a doctor, look at your doctor. And if you see the doctor doesn't look confident of what they are saying, or, they are scratching their head, I don't know, why don't we try this? Hey, it's your body. You are entitled, in this country at least, you are entitled to a second opinion.
We'll go back to steroid. What is it? What kind of a steroid would?
Any steroid,
What would that
any
be? Give us-
corticosteroid that you put on there, is if you have any other rash that is not induced by an infection, it will clear away. So this, when we look at rash in general, we talk about steroid responding rash and non-steroid responding rash. And we sort of break rashes into those big groups. But those are rashes someplace else in the body. But when it comes to your breast, remember about the orange skin. So if it's a little rash that doesn't look like an orange skin, it probably benign, and the steroid treatment might be okay. But if it looks to you, when you look in the mirror, if you look at an orange and you look at it, you see those little lines on an orange. But this one is not yellow; it's a little bit red because it's your skin. It's breast. If it's a black person, you might not see the redness, but you can still see the orange skin. So if it doesn't look right, steroid is not the answer to that. Now you can have a little rash anywhere in your body, in the skin, and including your breast, and it can be a steroid respondent, but it cannot be looking like orange skin rash. Those, when it looks like that, when it have that orange appearance, it have to be attended to, and I have, a few surgeons that I work with, Dr. Ron Harrison, Jonathan Levine. I have a few surgeons that I know that when I call on them, they jump on the case. We waste no time, and we take care of those patients immediately. I have, one patient that came in with pancreatic cancer, and I did my pre-op. The moment I did my examination of the belly, and I said, this looked to me without my ultrasound yet. Now, mind you, that
you
I
told
do.
us this
I have the
story, I
ultrasound right in my office.
Yeah.
I ordered my blood test to prove myself that this is pancreatic cancer. I did my pre-op. I said, I'm going to do your medical clearance. I sent her to the surgeon, and I tell the surgeon that Dr. Mencia have already initiated my pre-op. He want me to undergo surgery ASAP. And the tumor marker came back extremely high, which means that, yes, I was right, it's positive. The ultrasound that was done right then and there at my office, it confirmed that the mass was located in the pancreas. We removed the mass, and pancreatic cancer is a killer. You get diagnosed with pancreatic cancer and it get overlooked, or you tend to ignore it, it will kill you in less than 5 years. So, this lady, she's very religious. Now she spends her time going and preaching and talking to other people about her religion. And that's beautiful. She's living a normal life. It's a young woman in her early 60s. So she's living her normal life and enjoying herself. So cancer in general can be very aggressive. It can be passive. We can have cancer that are passive, that are slow growing cancer. For example, prostate cancer. A man in their 90s with prostate cancer. The last study that came out showed that doing nothing gives those people a better quality of life than doing anything, than putting them on chemotherapy, doing surgery, blah, 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 because it's not going to extend the quality of life or their life expectancy. It's not going to change it because it grows so slowly. But once we hear the C word, we all get scared, crazy, and we got to do something. Not necessarily. Sometimes we need to wait and keep analyzing to see what is the best thing to do. But with breast cancer, I have one nurse, and she had been my patient for close to 18 years, going to 19 years, because she used to come when my little daughter was in diapers. And she's from Nigeria, and now she's a nurse practitioner. She's from Nigeria, and she came to me, and she has breast cancer, and it was aggressive, and she wasn't, just a young woman.
Excuse me, does it only go into the one breast, or are they?
No, usually one breast. So my suggestion to her, she has a very strong family history of breast cancer, very strong family history. 18 years ago, it wasn't that easy to do the BRCA test, BRCA1, BRCA2, the genetic testing. So I suggested, I'm a beautiful, beautiful woman. And I say, my suggestion to you, let's do a bilateral mastectomy. Let's remove that breast, and God willing, your lymph node had not been taken because it was moving fast. So I say, let's do a bilateral mastectomy. And now you hear all these starts. So-and-so, she did a bilateral mastectomy. Come on, man, I've been doing this for over 20 years. So sometimes it's the best thing to do. Why? Why bilateral mastectomy? When you know that the family history is very strong, number one, and you are afraid of being affected, or you are already being hit by breast cancer. Because the only way breast cancer can grow is if you have breast tissue. So if you go to a good surgeon, and that's why I don't use just anybody, I use people that understand what we are doing here. When you have a good surgeon, and they go ahead and open you around that nipple, and they go and scrape any tissue that is breast tissue, and then just leave your ribs and your muscle and the skin and your nipple, and we can put an implant in there, and we can close you up. So therefore, there is no more breast tissue left. There is no way that person will ever whatsoever get breast cancer.
Wow.
Because there's no breast tissue. It's like if I go and I ask one of my doctors, I say, why don't you just remove my prostate but completely? Do not leave one cell that belongs to the prostate. If you do that, I will never get prostate cancer. It's impossible.
So that's really, that's the wonderful advice. Well, Dr. Andy Mencia, you hear him every week here on our show. He's the founder of the AGI Medical and Dental Centers. They're open on Saturdays. He rushes down right after this show to go to his office, where they're there at 1608 East Commercial Boulevard in Fort Lauderdale. The phone number is 954-489-1345. Remember, this is Pencil Talk Radio. Write this number down. I have his number on my refrigerator. I don't have anything else on my refrigerator but his number. That's really important to me. I mean, I don't know what I would do if I didn't know where I could get him. 954-489-1345. Home visit services are available for the homebound patients, and his website is agifl.com. agifl.com. And remember, he's going to be one of our major speakers at the upcoming Cure Symposium on November 12th. I want to keep going back with this because my question is, Dr.
Mark
Mencia,
your calendar.
I want to ask you, though, how young, I mean, So 40-year-old women, should they be having mastectomies?
It depends. The first thing, definitely, I have done no mammogram, but let's say ultrasound in 20-some-year-old women, that because they are very concerned and they have not have any kind of imaging study to look into the breast, because you can palpate trying to feel your breast, but you can, with an ultrasound, you go much deeper. You get to see the entire breast. So I get women, although the insurance might not pay for it, some person will gladly, even a man, they will gladly say, you know what, it's not that expensive. Let me pay for a ultrasound just to have a baseline that I am okay. So it's you are not blind. It's it's your body, it's your life. So you are not blind to an ultrasound. Is not radiation, so you're not getting any type of radiation. It's very benign. So ultrasound basically is a probe that we put there, like when we do an echocardiogram, and it sends this wave into the tissue, and then the wave come back, and the receptor will catch those waves and put it in a computer. It's a very simple mechanism of us analyzing tissue. And I get young women that because they have had breast cancer in their family at a very young age, and we have done those things. We have done the ultrasound and all that. So the choices are, if you have a very strong family history and you are on top of your breast frequently, every month you are examining your breast and as needed. You don't have to wait 30 days to check your breast, but you shower every day, hopefully. We shower every day, and when we shower, we should, examine from time to time, examine your breast to make sure you're okay. But you have to take at least 1 day out of the month, and do a thorough examination of the breast. Now, if you are super concerned, you are a warrior, you can't sleep, you get a nightmare, then, if you have a choice, then a bilateral mastectomy won't hurt you. And if you are married, talk to your husband. Talk to your husband and say, for the sake of peace of mind, this, let's consider that. And when you come to see me, come with your significant other. Because, even though you are removing the breast, you want to get your significant other involved.
But can't you have reconstruction surgery?
If you do it before anything happens, it's much, much easier to have reconstruction surgery. Because sometimes, a person let's say the cancer go and it's already invading the skin. We're going to have to remove that piece of tissue, whatever the cancer is. So the way we do the surgery is that if the cancer is an orange, it's not to get the orange and leave the skin behind. We have to get the orange and a little bit of the table and a little bit of the plate, and we have to prove that around that orange, all the tissues are completely normal. And that's a complete removal of the cancer. And then those cancers, they travel to the lymphatic system. Mm. So we have to go and look at the lymph nodes and take some of those lymph nodes to make sure that those cells have not traveled there yet.
Dr. Mencia, and before we run out of time, I'm glad we've covered this, but there's something that we didn't cover and which is very important, that somebody cares and knows, like you do, that when this happens, you talked about the husband, you tell your mother, if your mother's still living, tell your children. You need a support system, and you need the doctor to help be the orchestra leader, to help everybody understand that it's going to be okay, because the first thing is people think they're going to die.
Okay, that's correct.
And you are that kind of a person. You are so kind and gentle and smart, and I would think that I just can't believe anybody goes to any other doctor but you. It's just, but especially when you have cancer, you need someone who's understanding and can guide you. They don't know. They could start reading everything. They start going places. Yeah, it's hard, isn't it?
It is hard, and what we are doing now is is great. It's education. I remember when I had to do a symposium. It was in a big church. It was a big symposium where people there from our faith, and it was for the community. And we were talking about breast cancer prevention. And I was telling the audience, and this was about 20 years ago when I first moved here to Florida. I was telling the audience that I wanted you to raise your hand. How many of you had taught your teenage daughter to examine their breast? No one person. That's right. Out of hundreds of people in the audience, no one person raised the hand, because who's going to teach a teenager to check their breast before, when the teenager, then breasts start growing, they're gonna look at their breasts. Oh, look at my little nipple, they're getting bigger. Oh, look at this. We teach the girl, we teach them how to clean her private part. Yes. And how to wipe, yes. in the right direction, because, a girl needs to wipe properly, yes. so they don't bring an infection. Well, we should take the same teaching time to teach them at a very young age that because their breasts are growing, they have to protect those breasts and look for lumps.
Well, we've done it again. This is so educational, and I
you
thank you so much.
That here for the first time.
Yes, that's true. It's wonderful. Thank you, Dr. Mencia,
You're
and
welcome,
I hope that
Anita.
Everybody goes down and gets their flu shots. And it's we have no more time. 954-489-1345 until next week.
AGI Medical and Dental Centers wants you to receive the finest and most personal medical and dental care in South Florida. Founded by geriatric physician Dr. Andy Mencia. They combine comprehensive and diagnostic medicine while providing personalized medical care for each patient. Now in 2 locations, Fort Lauderdale and Boynton Beach. Their medical staff is trained and dedicated to utilize the latest medical cutting-edge technology, along with listening skills to provide their patients with the best medical and dental outcomes. Here's some of their unique services. Second opinions for peace of mind and assurances of outcomes. Dental care by prosthodontists and periodontists, from the simplest oral cleaning to a full implant program. Medical professionals visiting and caring for patients who are homebound. Saturday office hours. Go to their website at agifl.com. Be sure to listen to Dr. Mencia and Anita Finley on the Wonderful World of Wellness each Saturday morning from 7 to 7:30 on WSBR Radio, 740 on your dot. To become a special patient, call AGI Medical and Dental Centers at 954-489-1345 in Fort Lauderdale and 561-270-6494 in Boynton Beach. Medicare and most insurance accepted.
Thanks for listening to The Wonderful World of Wellness with Dr. Andy Mencia. Be sure to tune in each Saturday morning from 7 to 7:30 right here on WSBR 740 AM.